2 credit hours. And we have our speaker, Dr. Stefan. Are you ready, Dr. Stefan?
Let's go.
Okay, the mic is yours and we can start the CME.
Okay, excellent. Thank you. My name is Stefan Hartman, PA, owner of Iron Direct Primary Care. I'm going to share my screen here and we're going to get started with the lecture. Today, I have a report, both a mechanistic report as well as a patient report on a basal cell carcinoma eggplant treatment. It's not really eggplant treatment, but you'll understand why by the end of this. So a couple learning points for this CME lecture. This is a potential alternative treatment for basal cell carcinoma. It is salicylic glycosides. They offer a topical, non-invasive approach to treating a BCC, basal cell carcinoma, and potentially less aggressive form of treatment compared to some of the other ones out there, which we're going to talk about. The active ingredient in one of the products that circulates online is the salicylic glycoside. There's a product that this patient that we'll talk about, she used, was Curaderm. This is not sponsored by them by any means. We're also going to talk about the mechanism and the active toxic and medicinal properties of the nightshade plants and fruits out there. And we're going to talk about what that kind of looks like. This is the traditional treatment for a basal cell carcinoma on the face that this patient did have. And the surgery is very expensive and quite invasive and can sometimes leave some odd scarring on the face, as is this the case. So can we really just use eggplant to treat basal cell? Well, let's talk a little bit about the real ingredients here. So Curaderm, again, is a bound salicylic glycoside, BEC, because that's hard to pronounce. And we're going to get into the mechanism a little bit. It's medicinally approved in some regions in Europe, not approved in the US. Dermatologists don't typically use this. It is from a natural plant called eggplant. There's lower concentrations, obviously, in eggplants. You can't just put an eggplant on a basal cell and expect it to work the same. There's also another active ingredient that may make it even work better, which we're going to talk about at the end of this lecture. Specifically for our compounding pharmacists here in the chat, they may want to pay attention towards the active ingredients that make this so effective. And it's salicylic acid, which you may have heard about. It's an aspirin. And it's a keratolytic agent, which means it removes skin cells. So the combination of the BECs as well as the salicylic acid may be the real magic to this. Let's talk about nightshades. You may have never heard of these plants before. I know years ago, I had never heard of these before. Actually, a naturopath told me about these because I was complaining that I was having these arthritic conditions in my joints from the tennis. And he's like, cut out the gluten, the dairy, or the pasteurized dairy, and the nightshades. I was like, what's a nightshade? Well, let's talk about that. They're in a family of vegetables like potatoes, tomatoes, eggplants, peppers, and they belong to the Solanaceae family. Right? It sounds like the BEC that we just talked about. They can contain various compounds, including the solanine alkaloids, salicylates, and other glycosides. Glycosides are molecules where sugar is attached to another molecule, often with a biologic function. So salicylates, which is found in aspirin, is also found in natural foods as well. Some have very high amounts of salicylates, some have low. And so patients of mine who are very sensitive, maybe have some autoimmune diseases, I'll sometimes advise them to maybe remove nightshades from the diet. I mean, sure, you can do fancy functional testing to see if they have sensitivity, but a nice test and cheap test, free test I like to do is a elimination diet here at Iron DPC. We put them on a very simple diet, usually just meats, and they avoid all gluten, dairy, and nightshades. This is the common denominators that cause people problems, and then we reintroduce foods a little bit later. So this is a bit of a preview of what we're going to talk about. This is the Curaderm, right? Low concentration of the BEC is effective for the treatment of the basal cells. So let's talk about the mechanism of action for my nerds here in the chat. I know I'll get asked about this. So let's talk about that. So psilocybin is a naturally occurring aglycan of the glycocaloid in eggplant, Solanum melan. I can't pronounce that. It's Latin. was found to inhibit proliferation of various tumor cells. So there's about 4 different mechanisms we need to understand about why this might work. So psilocybin downregulates the expression of MMP2 and 9 and mprin, but increases the expression of tissue inhibitor metalloproteinase 1 and 2, and reversion-inducing cysteine-rich protein in K cell motifs. We're going to say REC. So REC is a membrane-anchored glycoprotein that negatively regulates MMP2 and MMP9 activity and inhibits tumor invasion and metastasis. The downregulation of REC is often associated with increased invasiveness and poor prognosis. The other thing that these BECs modify is PI3K, so phosphatidyl inositol, which essentially regulates autophagy in the body. So our own cellular turnover. We can put ourselves into autophagy by fasting. You usually get into that by day 72, by hour 72 of a 3-day water fast. You can put yourself into autophagy. But the psilocybin also modulates that autophagy role as well. Downregulation also of MIR21 by psilocybin may contribute to elevate REC expression and subsequently inhibiting cell invasion. And microRNAs. miRNAs are short, non-coding RNAs that control the expression of target genes by repressing mRNA stability and translation. miRNAs are involved in several important biological functions, such as cellular proliferation, differentiation, as well as tumor initiation and progression. Some mRNAs act as oncomeres that function as oncogenes or tumor suppressors. For example, MIR21 serves as oncomere and is upregulated in many tumors, including lung, breast, colon, prostate, and pancreas. The MIR21 regulates cell proliferation, migration, and invasion and metastasis by targeting different molecules. So the psilocybins found in the eggplant downregulate.
Hey, can I add something really quick?
Yes.
You mentioned the microRNA 21. That's what the dimethyl fumarate also modulates, and it's overexpressed in people, not necessarily all of them, or I cannot say it's all of them, but there's a connection between patients who have psoriasis and have a predilection for multiple sclerosis. And I remember seeing a correlation with lung cancer, that they have overexpression of the microRNA 21. And that's part of the reason why dimethyl fumarate is used for multiple sclerosis. So, and the other thing I thought that was interesting is this recurring theme of this, this plant alkaloid thing that, it ends in INE, which is, it has a nitrogen group. These are all kind of, in a way, they're stimulants, but they're venoms. They're what the plant or what the seeds use to protect themselves. And so there's this common theme that whether we're doing even like cytosine for the nicotinic receptors, these are all plant alkaloids. There's a commonality of these, that they are what's being used to protect the plant. We're using them to protect ourselves. But so I just thought that's very interesting.
It's fascinating. Found in nature.
Yeah, right. And one more thing, I hate to steal your show.
No, go ahead.
But your show is awesome. Is that the reason, and you tell me, the reason why the person said avoid these certain foods when you were dealing with the arthritis, my understanding, it has something to do with the skins and the seeds are abrasive to the epithelium of the colonic epithelium.
Well, yeah.
And so, right?
Yes. Causes leaky gut. It literally, that's why we're applying it here on the face. It literally dissolves cell layers.
Right, right. So it makes sense. So it's like, yeah, I mean, if you're vulnerable and you're dealing with arthritis, you have leaky gut. It's like, yeah, of course you don't want it because
Of course.
it's abrasive, but you do want to apply something abrasive onto a tumor cell, especially if it's also it's a poison in a sense. So you're poisoning the cancer and you're you happen to be regulating the expression of a commonly overexpressed microRNA. And microRNAs are, versus they're like communication signals coming from the DNA. We have peptides that are amino acid communicators. We've got steroids that are, cholesterol-based communicators or sterol-based communicators. And then you've got the microRNAs, which are nucleotide communicators. So we're just modulating, a communication signal that's overexpressed that actually triggers Th17 polarization, if you want to take it to that level. Man, this is getting good.
Glad you like it, Dr. Joseph. Yes, natural glycosides found in nightshades. So when consumed, exactly, they might break down your digestive system by the same mechanism that we're using them to break down carcinoma on the face. They dissolve cell linings. And if you think about our gut, it's pretty fragile. It's really only one cell lining thick. You can dissolve that pretty fast and give yourself leaky gut syndrome and then potentially autoimmune diseases. I mean, some of the active or immediate things people might notice if they're super sensitive might be digestive system issues, right? They may get acid reflux, burning, vomiting, nausea. I actually got a text from one of my patients the other day. She's got this 2-year-old and he ate these berries and they were a nightshade berry. And this kid was so sick from them. They're poisonous. And you Google it and it says, the child's going to die. Child didn't die. Child was just fine. We gave him some charcoal, perfectly fine. Child was violently ill from these nightshade berries. There are natural salicylates in nightshades as well. So they may provide a little bit of an antiplatelet activity, a blood thinning effect as well. They are potentially anti-inflammatory as well in the nightshades. It can't be used as maybe medicinally as an anti-inflammatory food, potentially. But we know aspirin is quite anti-inflammatory as well. Nightshade sensitivity, we talked about that. Gut and the autoimmune connection, we talked a little bit about that. So what makes nightshades toxic? Well, as we just discussed, it dissolves cell layers in high doses. This can potentially be fatal. So we don't want to be eating random berries in the woods. The mechanism of toxicity. The solanum glycoalkaloids have been shown to inhibit cholinesterase, disrupt cell membranes, and cause birth defects. One study suggested that the toxic mechanism of solanine is caused by the chemical's interaction with mitochondrial membranes. Experiments show that solanine exposure opens the potassium channels of mitochondria, increasing their membrane potential. This in turn leads to calcium being transferred from the mitochondria into the cytoplasm, and this increased concentration calcium in the cytoplasm triggers cell damage and apoptosis. Potato, tomato, and eggplant glycoalkaloids like solanine have also been shown to affect active transport of sodium across cell membranes. So this cell membrane disruption is likely to cause many of the symptoms of solanine toxicity, like burning in the mouth, nausea, vomiting, abdominal cramps, diarrhea, internal hemorrhaging, and stomach lesions.
And I like how that's like a cholinesterase antagonist.
Yep, we're going to learn about that. It's atropine. I think it was derived from, or at least inspired from these plants. This is the plant that baby ate. He ate the berries, and he got very sick. So at high doses, or even at lower doses, I mean, it's a child, he may eat a handful of berries, and he can get into an anticholinergic problem real quick. It blocks the acetylcholine neurotransmitter. This can lead to paralysis, hallucinations, respiratory failure, and death. This is the 2-leaf nightshade that he ate.
Wow, it reminds me of cytokine storm.
Yeah, This is bad stuff. Medicines inspired potentially by this is atropine, scopolamine, and hyoscine. Hyoscine. Don't know how to pronounce that one. Medicinal applications of nightshade compounds. Capsaicin is a compound is what gives chili peppers their heat. It has an analgesic, pain relieving, and anti-inflammatory property, and is used in topical creams for pain relief. I've seen those over the counter at Publix even. Solacanium in low doses might have some antifungal and anti-cancer properties at low doses. High doses can be toxic. Atropine and scopolamine in control, these are pharmaceuticals. Atropine is used to dilate the pupils during eye exams and to treat slow heart rate, and scopolamine is used for seasickness. I've used that myself. So let's get to the Curaderm. So Curaderm contains a mixture of tri-di and monoglycosides of solocitine. The triglycoside solomargine is the most effective anti-cancer component and represents 86% of the total anti-cancer activity. Solomargine is a small molecule drug, is a triglycoside of which the alkylate salocitine is conjugated with 2 molecules of the plant sugar rhamnose and 1 molecule glucose. So it contains both the salocitine and the salicylic acid for the keratolytic as well as the anti-cancer effect, as well as some urea, which I thought was interesting. A bit of urine. I'm not going to get into urine therapy, not today. Actually, okay, let's see. So there's some studies where they've been actually injecting with a needle under the skin some of these lesions, mostly done in horses, where the horses with a big, actually malignant melanoma, and they will inject this product intralesionally, which seems like a kind of interesting and effective way, and possibly low toxicity way of delivering it. These are some of the images you can find on the internet regarding the Curaderm and its results over time. Usually it takes several weeks to start seeing some improvements in the cancers. Here's some more. I think this one is horse. Yeah, that one's this one's a horse one. Okay, this is my patient in his 60s. I noticed this on the patient's nose, and I was like, well, I don't want to biopsy this on the nose. I sent the patient to the dermatologist. Dermatologist did the biopsy. Sure enough, it was BCC, as I thought. And he suggested Mohs surgery for the patient, and long sleeves and wide brims, which the patient had been doing anyway. So the patient didn't really want to do Mohs surgery, so started looking up online how to treat it himself, found Curaderm, and started using it. Interestingly enough, the patient unfortunately told this dermatologist what they were doing and received a priority mail firing them from the practice the next day. So lesson is, I guess, don't tell the conventional dermatologist what you're doing. You just keep it between the integrative and the patient, because I'm all for complementary treatment. I'm not going to fire my patient because they want to do something different, but that's what you're going to get anywhere else. So this is some of the YouTube success stories on this thing. So this is what inspired the patient to do this. Let's see. The derm did do a great job at the biopsy and seemed to remove most of it. And that may be as much as a diagnostic as a therapeutic tool. And that's what some of the literature suggests as well. If the dermatologist is good enough, they may remove most of it anyway. Patient didn't want to do Mohs. It was expensive, scarring. This is before the biopsy, and this was after the biopsy, so the dermatologist got a good amount of it out. Patient also had access to a hyperbaric chamber. It was doing 5 times a week, hyperbaric at 1.4 atmospheric pressure. They treated with Curaderm, and they'll notice some purulence when they start doing this. It looks wet and moist. However, the patient's hyperbaric use dried this thing up so fast, it healed rapidly. And so they had to repeatedly apply this Curaderm every day. The purulence is potentially the cancer being killed, according to Curaderm, that company that they were using. Purulence, the tape removal, the white is Curaderm. Day 17, patient stopped. Wound had no purulence and was closing. The wound was closing every day from the hyperbaric. He did not wait until the wound closed. Curaderm recommends using the cream until the wound closed. By day 15, he had seen no purulence and reduced treatment to 2 times a day. He stopped on day 17. Pick is day 23. The wound was closing quickly. After stopping the application of Curaderm, patient covered the area with tamanu oil with no tape after stopping the Curaderm. Patients say they would treat the same way. Avoided Mohs. Happy with the result a year later, which is why we're giving this lecture here. And it figures that the shaved biopsy did take care of most of it and is happy with the results. There's a lot of YouTube videos. 1 year later, kind of a blurry picture here. That's what we got. Now, this is where the compounding pharmacist may pay attention here, is if they want to make a product maybe more affordable than Curaderm or something even more effective, they need to read this paper by Renata et al., 2014 in Brazil. And they found a formulation that potentially is even better than Curaderm that gets deeper into the skin to dissolve this basal cell. So it's 5% alkylate extract, 5% propylene glycol, monolein, hydroxyethylene cellulose gel, and the pH was 6.5. They found that was kind of important to get it down into the skin. And this was the fruit that they used in Brazil. It was a Solanum lycarpum fruit. This is another nightshade that they have down there. The study showed that this Solanum fruit are selected for cancer cells due to the sugar chain moiety, mainly rhamnose. Let's see. The efficacy of these compounds not only depends on the quantity used, but also on the composition of the topical formulation. For instance, Ceto macrogol-based cream with 10% glycoalkaloids and 10% DMSO affected an 83% cure rate for the carcinoma, while another formulation with the keratolytic agent, so that could be salicylic acid. So you get the glycocalloid with the salicylic acid, so basically aspirin powder, is 100% curative. So that seems to be the theme there, is you want both.
So just so I understand, and you probably mentioned it and it went over my head. The aspirin part, is that to just keep the inflammation down while you're kind of killing it? Is that sort of the idea?
No. It's a keratolytic agent. Dissolves the skin.
So when we're doing the aspirin, you said this is that behaving like aspirin, or this is like when the other formula earlier involved the salicylic acid. That's a aspirin. So it's
both.
a exfoliant.
Yes.
Interesting.
Yeah. So you have both the exfoliant plus you have the anti-cancer mechanism in the cream.
Okay, and then there's another component then.
And yes.
I mean, just with the purpose of the other component.
Maintaining the pH, right, seems to be important as well. 6.5.
Okay, otherwise it would it's optimal. Otherwise it might go maybe too acidic and be too
not go through the skin.
Yeah, I mean, that would be like getting a really bad glycolic peel or something where you're blistering, like it's causing more damage than it's causing unnecessary damage. So you're keeping the pH from getting there's this optimal level. You don't want to just blast it, burn it off, and burn off half of your face.
Mm-hmm.
So this is
the
way.
fruit that we have available commonly, I guess, in the US that's used this is the eggplant, but in Brazil they use the solanum, which may be even a little bit better. S-lycocarpum. Cool. That's all. Closing thoughts. These psilocybins are affordable, have well-defined mechanism of action, and we can apply them topically and affordably for basal cell carcinoma, The Curaderm is available online, and this patient used it and had a good result. But I think compounding pharmacies can learn, especially from the Renata et al. Study, of how to make even a better compound.
That was fantastic. I realized I made a mistake earlier when the kid ate those berries and was having nausea and vomiting and hallucinations, and those are all too much parasympathetic stimulation. So that would be like a nicotinic acetylcholine, too much. But at a very micro dose, that would serve as like nicotine or cytosine. Those would serve as stimulants or relaxants, or stimulants and relaxants at the same time. Makes sense because those nicotinic receptors, when you get familiar with them, some of them are, obviously part of the vagus nerve, and so that's affecting the stomach and the breathing, and other nicotinic receptors are involved with dopamine release in the front or the pre-basal. Trying to get familiar with these regions, the more towards the front of the brain. Too much dopamine stimulation causing hallucinations. It's too much stimulation. That's really, the stuff makes sense when you kind of get your brain organized around what's doing what and the commonalities. But it really makes sense now how the commonality between why, these poison berries, the symptoms why they're poison is because they are venoms that are used to protect themselves against insects and other things. They are coming from the seeds. You don't want to eat them. Well, I mean, you don't want to eat those ones anyways, but the nightshade foods that you're talking about, if you're already having leaky gut and those seeds in the skins are acting as poisons for that and worsening the leaky gut. That's how I'm seeing it. And it all comes together and makes sense that we're dealing with different versions of the same thing. Just some of the things we eat normally, we have to know when to avoid them because it could be causing more problems. Too much of something can have problems. Less of something can serve as a good thing. Some things can be used as helping to balance the neurochemistry of the brain if they're at the right dose and it's the right kind of venom, I guess you could say, plant alkaloid. They all have a common theme that they're enes, like amphetamine, dopamine, cytosine, but then at higher doses, they can be used again to protect us against the enemy, which would be cancer. So no, this was a great lecture. What inspired you to even think to do this?
It was my patient. They didn't want to get the Mohs, and they started doing this, and then we went down the rabbit hole.
Yeah.
So can I say a few things about learning all these? We should not be afraid of taking the nightshade family because because the heat has an effect on the antigenicity of the and the toxicity of the nightshade family ingredients. Because if you are, I'm talking about many of our patients, those who are allergic. If they eat tomatoes raw, they have a problem. But with the sauce, they don't have a problem. The same way the eggplant, if it touches their mouth, they have a problem. But once it is cooked properly and skin is removed, they don't have a problem. And they eat the eggplant, which has a less amount of seeds. And there is a way, when you purchase the eggplant, you can know that this eggplant probably would have less seeds compared to the very tight, nice looking eggplant If it is very tight, it may have more seeds compared to the soft one, which are the Japanese eggplant or the baby eggplant. So, and the pepper, it is the similar that if you cook it, saute it, it has a different effect than eating raw. So I think that listen to your patients and then go accordingly. And antigenicity has been proved. We have done the extract of the raw pepper or raw eggplant or raw tomatoes and have tried to skin test and very, very sensitive compared to when they are cooked. So keep in mind.
Makes
Because
sense.
these are really a good food, and we should not completely avoid that. But if you know how to eat right, then they're very beneficial. As you just saw, that cancer patients, I always tell them to eat eggplant, but modify. Don't eat raw and cook them. And if you see a lot of seeds, and I teach them that how to find the right kind of a raw eggplant and then cook it, and usually they are very well tolerated.
You know, Dr. Patel, as you were saying that, the first thing that came through my mind is either this is something that perhaps you studied, or this is, you know, wisdom that was passed down, because I get the sense that eating and deciphering and knowing what to eat is something that would normally be passed down. And you know, I feel completely clueless. I'm not blaming my family, but
Yeah, but you know, here when we go out and order something, well, okay, you eat potato, there's a large part of potatoes with the eggs. Well, you don't eat that way. You eat small amount of potato, you're not going to have a problem. But if you eat as much as what they put in your dish, if you eat that, you're going to have a problem, because you are then again eating the food that you are well tolerating well. That food, if you eat first and then the food that gives you problem, you follow it with it, then you may have less reaction because it's not hitting your stomach and the GI tract right at first. And then it's like it is coating, and then you eat the food that you're sensitive, not super sensitive, okay, like you're allergic, but I mean, it can probably give you, if you eat in a large amount and if you have symptoms, you can still eat in a small amount and you will well tolerate it. Like,
yeah, I've heard that, you know, before. I mean, it probably is, this is common sense to some people. I remember I was having dinner with a family from the country of Georgia, and it was a surgeon, and I was showing him some procedures, and we had one dish to start with and another dish to start with, and he said specifically, like, this is, you know, what you eat first. This is to so you tolerate the second dish better. And I thought, I got the sense like this was common knowledge for them, where this is kind of lost knowledge. Although my mother was very natural and did a lot of her own farming, and so I was lucky in that sense. But you know, generation after generation, it seems like this knowledge gets, in this country, we'll say, it starts to get lost because of all the conveniences and running around and doing this, and you know, less family oriented communities, and pretty soon you can imagine that people are so clueless, including myself, and then you start reading the cookbooks or reading the different diets, and then you get confused. Is it oh, okay, is it raw vegan? Is it eat for your blood type? Is it keto? Is it this? I mean, this is a really confusing. This is a big deal. It's a big deal, and yet there is a simplicity once you kind of understand the basic fundamentals.
just like we say that, oh, stay off gluten, but most of the gluten of the American wheat, it's really, nobody should be really eating American wheat, okay? Because it is so low quality and it is just full of starch and gluten. But as compared to that, if you get something from spelt, which is a really good grain, and if you see it, it is a if you eat that with the fiber, it is much well tolerated. So, I mean, you tell somebody to go off gluten completely if they are super gluten sensitive celiac patients. But in general, we have to tell the patients the no gluten because they will either go and eat the bread, and bread is also have a yeast in it and ferments, and they put cellulose, and cellulose is nothing but the wood, the shredded wood, the wood dust they put in it, and the shelf, the bread which is on the American grocery store shelf, they all have cellulose in it, and that is a wood fiber. So one has to be and that wood may be pesticide treated wood. So then if you are eating bread, are you reacting to the gluten? Are you reacting to the yeast? Are you reacting to the cellulose or the other ingredients they are putting? But if you make the some preparation which does not involve anything except the spelt flour and little salt and a little oil in it and water, and then you make a really thin chapati like Indians eat, you usually would not have a problem. But if you go and eat 2-3 slices of bread, you are going to have that person may have a problem. But when they eat 1 or 2 chapati, they don't have a problem because that bread is made from American wheat. It's not made from spelt flour, and it has many ingredients in it. And compared to the gluten content, it is low, and the high quality food.
So it doesn't make sense then when you go to a restaurant and you're being served bread, to eat before the meal, and
That's
you just
right.
eat the bread. You're eating in the wrong order.
Yeah, and then we don't know that because that low quality American wheat are loaded with aflatoxin. It has and it has a fuminosin. There's another mycotoxin in it. So we have to really see what we are eating. We may be blaming gluten, but it may be the other ingredients.
Yeah. The other thing I thought was interesting, Stefan, is glyphosate was part of the chemistry at the beginning of the lecture. And, it dawned on me that, glyphosate, obviously we're talking about plant poisons and things. That's how they protect themselves. But immediately it made me say, well, oh, I see where to get the glyphosate. Maybe it's modified glyphosate, and it's just drowning the the crops with the glyphosate, and so you're just getting massive amounts of poison.
Yeah, glyphosate.
And I have a patient who's so sick. I mean, this is probably the sickest patient I've seen so far as their lab work, had like the highest amount of glyphosate levels on functional medicine testing that she had already done before I had seen her. I mean, and she had high amounts of a specific mycotoxin. I think it's citrulline.
Citrusine, citrine, there is citrine in it.
So yes, I mean, it's a terrible one, isn't it? Like it's because of neurotoxicity.
But I think the Great Plains Lab, if you have results from them, I see that they have a higher number of population. Those who come to us have a higher level of citrulline. So there is a big question that when you run with the other lab, it doesn't. But anyhow, all it tells you that there are mycotoxin present, and that patient is probably not eating. If it is a large amount of glyphosate, then they have to learn to eat the organic food before you do anything. Good glass bottle water, organic food, and good air, because I mean, mycotoxin comes from many other sources besides the food. So that air, food, and water, all 3 things have to be addressed first before, I mean, you may do other things, but these are the basic three things that everybody should pay attention to when they see their new patient and very, very sick patient. Because if you don't pay attention to that and you move on to other things and they're eating the same thing, then it's less likely, because the large amount of food that what we have to eat in order to provide the adequate calories for optimal nutrition, you really have to consider that what is she eating, and part of the dietary nutritional history should be part of your history, so
Of
immediately
course.
know that what is the role, and ask them that how do you feel after you eat, and
Yeah.
many times they will give you many different answers, and that may be a part of your treatment program.
Of
Oh,
course.
somebody said something that made sense. And this person eats extremely healthy and had healed herself from heavy metal toxicity and had activated Epstein-Barr. And by the way, this patient had like activated cytomegalovirus, Epstein-Barr, herpes type 1. I mean, it was, a hot mess. That same patient. But this one stood out to me. She said, I had to make diet a full-time job for a while, meaning like
Yes.
literally, like, and that's the other problem. I realize why you can read all the different philosophies. Oh, you got to have this, you got to have that. But if you're running around, which is, we're trying to pay our bills, we're, doing this and doing that, and you cannot learn anything. You have to learn eating
You,
and
you
diet.
start with your meat. You start with your meat, then you go to your grain, you go to your vegetables, and you find out if that patient is a heavy in vegetables, you
No,
start with vegetables.
I'm saying for oneself, before, how can we educate the patient if we have not made I'm just using the term, a full-time job for a while, learning how to eat and make those fine distinctions. That's what it takes. And how many guys out there are cooking and spending time in the kitchen? Besides Stefan, but it makes sense because all that time that you spent, you've normalized this knowledge, and you understand what you're doing, and it's common sense. Whereas somebody who hasn't, they think okay, I'm going to read this book and try this one thing. They're not seeing how it all comes together, and they're focused on other things in life, and they're still confused. That's what seems like that's what happened to me. Okay, so it's no wonder that, and it seems to me that some other physicians also, they don't know anything about diet. Why? Because in order to learn it, especially if it wasn't passed down, you're going to have to make a full-time job of it for a while, somehow, some way. That's what it takes.
Yeah.
Otherwise, you shouldn't even expect yourself to understand. There's no way that you're going to understand it. And then maybe have somebody that, that can, teach you a little bit and speed up the learning process. But that, that's what I'm trying to say is it's easy to say, yeah, we need to counsel the patient, but how can you counsel the patient unless...
No, you have to know it before you can counsel the patient for yourself. And what difficult job you are asking them to do once you find out yourself that how to eat it, but it can be done. And I know how to, I have a whole program how to teach it, but unfortunately my schedule is like that I cannot give lecture, but I have a lecture on this.
Yeah. And by the way, what I'm not doing is saying that's why we can't learn it, because we're not making a full-time job of it. I guess why I'm saying the big aha for me was that's why I didn't learn it. And actually I do things now that do make sense, because I actually did treat it like a full-time job for a while. And then it got easier,
Right.
easier
Exactly.
over time. And so that's just coming from experience.
But these days there is a craze for juicing, but they are eating the same food over and over and over and over. and oxalates are not very easy on the digestive tract.
No.
So when the oxalate goes through that, it's going to make the microscopic holes, and you are preparing your gut to start having some leakiness, and then you are going to develop over a time the sensitivity to certain foods. You may not be allergic, but you may be sensitivity, and sensitivity is sometimes even worse. It is not well recognized, and as a result, a sick person, oh well, I had it, I'm not feeling any better, or I felt better but I'm not feeling better, and then they end up not drinking enough water, and then imbalance in their oxalate, and they start making the stones, and then particularly in the area which are very hot, which require the larger amount of water on every daily basis, they don't drink. Patient does not drink, and you have to tell them that you have to have a 2-liter bottle, and you have to fill it, and you have to see that that bottle gets emptied completely, and then that 64 ounces, that 8 glasses. And in Florida, you may have to drink even more. If you are exercising, you have to even drink more. So you have to emphasize on these basic principles to the patient. And sicker the patient, the requirement is even higher.
In which environment?
The very, very heat, like in Florida, Texas, wherever there is a high environmental temperatures, external environmental, where they may have a 90-degree, 100-degree temperature outside. They are going to have a lot of perspiration, and even if they don't perspire, even they are inside, their water intake is higher than compared to the upstate New York where we live.
Hmm. Wow. Yeah, we drink a lot of water, but not only water do I recommend for my patients, but balanced water,
Yes,
repleted
yes.
with electrolytes, sodium,
Yes.
potassium, and magnesium.
Absolutely, but not all 64 ounces. I would just say that about 16 ounces, that would be sufficient of that. And then again, if they are doing outdoor heavy work and they are perspiring, yes, they are going to lose a lot of salt and feel lightheaded. Then immediately you know they need electrolytes.
One common thing I find is patients are see another doctor and they say, drink more water. What do? They go buy purified water and they drink. They have to hit this bar, large gallons. They have to drink every day of purified water. They have headaches. They feel tired, fatigued. It's because their cells are all swollen up.
Yeah, everything has to be balanced.
Yeah,
And
balance.
you're right. We have to tell them. And right now those packages are available, electrolyte packages.
Oh, yeah.
So even
Yeah,
if they are working, they can take the package and put it in the water, no matter where they are. But please let your patients know not to drink from those plastic jugs, plastic bottles, because they are going to get so many chemicals from that.
Ah, man. I was wondering, Dr. Patel, do you have a suggestion for a filtration device that can filter out the plastics in these bottles?
Uh,
Do you know of any?
Well, the filtration device, you would filter the water and put it in a glass bottle, but from the body to take the plastic out, that's what you're saying?
No, well, I'm saying, I'll show you what I get here. So I get these from Culligan and I put them and
No,
it's
no
spring
way.
water.
No way, you should throw that away. You get Mountain Valley water, which comes in the glass 5-gallon jug. It's called
Yeah.
Mountain Valley water. It's a little more expensive than that, but I think it is worth, because you are paying for man-made water. That's because it's filtered, and then they fill in that. But the Mountain Valley water, it comes from the hot springs of Arkansas.
Yes.
And it is very pure. It is tolerated by over 95% of my chemically sensitive patients. Those who cannot, tolerate any other water.
Amway has a new eSpring water filtration system for the home. You know, it's a unit that you would put in your kitchen or whatever. And their new one now filters out, besides everything it used to filter out, it also filters out the microplastics.
Amway? Okay.
Yeah. I'm a distributor. You know, if anybody's looking for some information, just contact me. But they have I've been using their systems for 30 years, but this newest one also filters out the microplastics.
Oh, I need that.
Yeah, so why don't you, how can I give you well, you
I
have
don't
my
know.
email. My email, you have it because you're the moderator, right?
No, you just put it in the chat here.
Mm-hmm.
But if you get a reverse osmosis system, that should probably take care of that as well. And Callaghan actually sells a reverse osmosis system that they place under your sink. So then you can filter your water that way. Instead of buying the water they sell to you, you filter your own and you can use it. So Callaghan does that. Ask them.
The problem with reverse osmosis is maintaining it. It will grow mold so quickly.
Oh yeah, but Callaghan also comes and cleans it up for you. They set it up that they come so often during the year to replace the filter, to do all of that.
And it will filter out the atrazine
It should.
and the pharmaceuticals, the birth control, all of that.
Yeah, all of that. Because remember, reverse osmosis is the best filtration system. Unfortunately, it takes out all the minerals.
Yeah.
And that's why you need to
I-
supplement with the minerals.
I really don't advise the reverse osmosis unless somebody already has in their house. I just say you get this water, you drink your water and see where you feel better, because it takes out the minerals and then you don't know what it is out and how many percentage wise, how much pesticides are removed, because we got the report and it is not pesticide free.
Yeah, to test it costs so much to test the reverse osmosis to prove that it's working and that it's clean, has no mold. It's expensive test.
Yeah, just ask Callaghan and see what they can give you in terms of tests to prove that the system they installed for you is actually doing the job. I think that would be a good test.
Yeah. Oh, look. Because I hate these plastic bottles.
There is another Japanese system that is better, but I don't recollect the name right now. But I let
Kangen machine.
yeah Kangen water.
The
That's
Kangen machine.
probably of a better of other osmosis.
Yeah, the Kangen machine does a lot. It gives you also alkaline water.
Yeah, but alkaline water I wouldn't drink by I mean, if I would drink a glass, but I have seen a number of patients becoming very sick and very chemically sensitive, unable to tolerate anything and all they did was drink alkaline water.
Yeah, that's because they have a high pH, like pH 9, pH 10 that they're doing.
Yeah, so
Yeah.
that's why I said it is good, but not as a total amount of water I would drink.
Right. They can do a pH of 8 or so maximum. Probably that would do them good, but they go overboard and do the high pH.
Oh yeah, he was a distributor for alkaline water. One patient I had, and
Yes.
he was so sick that he looked like worse than a cancer patient.
I know, and because they dilute the acid in their gut and they don't realize that. So in a way, they put themselves at risk for digestion issues and everything else.
Stefan, I have an experience with Curaderm. So one thing that I definitely tell my patients who chooses to use it, it'll get worse first because it will unveil the cancer before it gets better. So this kind of turns off these people if they're not given heads up about it. But I do have patients who respond to the basal cell. So
Yes,
just
I have experience too. Even sometimes it looks like a crater. It looks like a squamous cell carcinoma. While they are getting better, initially in a first 21 days, and wonder why did I start that? If you are the one suggesting it, in your case, your patient started doing it and he was well with it, his progress. But if you are suggesting someone brand new with that diagnosis, then you just say first 21 days, you may see that you're getting worse than better. And
It looks bad when you look at it. It looks all slimy.
yeah, not just slimy. I'm just telling you, like you would just see the squamous cell carcinoma patient. I mean, it looks raw with everted edges, and what you saw was just the first few days. But as time goes and when it opens up, it looks really bad.
Yeah. Have you
And,
used
and,
it?
and it looks worse after it's cut out and the flap is put over it.
Oh, yes. No matter which way you go, they're going to have some suffering. Unless it is very superficial.
Yeah. Have you used it in anything other than BCC, Melvin or Dr. Patel?
No, sometime DMSO.
Ah.
With DMSO.
No, I meant BCC. Have you used it in squamous cell or anything else?
No, I haven't used it in squamous cell.
Yeah, it's usually mostly BCCs.
BCC. Okay.
But I mean, you were telling about they have used in melanoma. I thought.
Yeah, and horses.
Yeah, in horses, but if somebody has a small melanoma,
Yeah.
you know, it is very, very hard to say to use something else when they come with melanoma. What I have done is I have injected in melanoma, superficial melanoma. After they have gone for the biopsy came out positive and the wound is still not completely gone. I have done the methylene blue paste on it.
Ah.
And there was one guy that I injected. It was a very small, like a smaller than a smaller pea. If you know mung bean, it was the size of mung bean, which is much quarters the size of the peas. And I did that, and gradually it disappeared.
Cool. Thank you. All right. Any other comments before we close out the session? Dr. Halasa? John Burgess?
All good. Thank you, Stefan.
All right.
It was very good. Excellent.
Thank
Yeah.
you. It's interesting.
Yeah, excellent lecture and great discussion, guys. I really enjoy hitting on, the fundamentals of diet, which Dr. Patel, you verbalized so well. And then Stefan, this lecture opens up a whole nother arena of thought and ideas and ways that we can, go about things the natural way and not just give into, surgery, but also it makes sense in understanding the mechanisms and why this would work. And also patient having a choice, and but also being confident, we're not just shooting in the dark and trying, there are studies out there to draw upon. And then once you understand it, like we were talking about before, you're exfoliating it, but you're not trying to burn off the face and, and it makes sense. Or the things that are plant venoms, we can use those to our advantage because they're toxic to the cancer cells.
Yeah.
Yeah, I want to let you all know that tomorrow evening I will be presenting on prostatitis and prostate cancer at Dr. Clearfield's show. I would be doing that tomorrow evening.
Wow, fantastic. I've been highly involved in that. I can't wait.
Yeah. So you're all invited to come
I'll be there.
for your support.
I will be there. I'll see you then.
Yes.
All right. Bye, guys.
What is the site?
Clearfield.
Dr. Clearfield.
Oh, Clearfield. Okay.
Yeah.
Clearfield. We'll be there.
Yeah,
Awesome. Awesome.
Okay.
Thanks, guys.
okay.
Not at all.
Good night.